I do want to talk about how 2020 and COVID affected people with mental health disorders, because we know that, although it was necessary, quarantine and staying at home and social distancing had a profound effect on mental health of the greater community, let alone, community with chronic mental health conditions. So what do you, what were some of the biggest challenges that you saw for the inpatient psych population the community last year? Because I know you were in the community last year.
Yeah, sure. I mean, I know for some of my friends who are working inpatient, it was a lot more difficult to get people admitted. So I think they actually felt kind of like less overwhelmed and felt a little bit like they had kind of like an enclosed space that they were working in. From the community standpoint, there were some pros in the sense that people that I was working with who didn't, there were so many resources for people who weren't making any money, so they were able to, things that we had been trying to get them for a while, we were like, jumping on, getting applications in, and people were finally able to, get some money and get some services. There were lots of food banks, so that was good. Wow. For me, I've been working, at that point, everyone I've been working with for about 2 years, so I had a really good relationship with them. I was working from home. They were all, more or less pretty safe in where they were staying. So I feel like personally, I wasn't super affected. I know that for some of my colleagues who worked in group homes, that was really difficult. Because people that live in group homes tend to be more severe on the spectrum. A lot of them have pretty chronic schizophrenia. And it was really, really difficult for them to keep the residents inside the house. And there are a lot of restrictions in Massachusetts about, what you can do. So they couldn't even stand in front of a door and say you have to stay inside. That would be, considered a restraint. So these, and the staff had to keep going to work, even though sometimes these people were going out in the community, and it just was really difficult to process. I understand that you want to go smoke cigarettes with your friends, but there's this really serious virus that's going, there just wasn't that level of understanding. So I think that was really, really difficult.
I'm sure conspiracy theories too are probably hit people with chronic schizophrenia really, really hard.
Yeah. And just this doesn't, it's really hard to picture this kind of invisible thing that doesn't really apply to you right now. I think too, that was more, I think definitely as time went on, I think it kind of sunk in, and I think as everything was closed and there wasn't really that much to do anyway.
Yeah.
I think that helped. And we did have a couple people get sick in the houses. So I think that kind of made it really evident too.
Yeah, that makes sense. I didn't even realize how, I know that there was a huge focus on, protecting people's mental health last year. I didn't even think about how positively, funding and everything and those stimulus checks for everybody would have benefited. That's awesome. I think I was just thinking that there was a negative impact, but I'm happy to know that gave people extra services and stuff.
Yeah, there were some positives for sure, I think the biggest thing now is that there's a huge mental health crisis going on with everyone that's been, so traumatized, working throughout the pandemic. Everywhere that I applied to be a nurse practitioner said that they have wait lists over 6 months long. Everyone's sense of control has just been shattered. So any kind of underlying anxiety, depression, one of the theories of how mental illness develops that I kind of most relate with is this idea that there are these, you have certain predisposing markers, and then you have kind of the trajectory of your life. So, someone with a predisposing marker and someone without might experience the same scenario, but one person might develop a mental illness and one person might not. And that might be because of the way they grew up. That might be because of certain biological things. That might be because of their, how they interpreted it. So I think this pandemic really exposed a lot of people that might not have been exposed otherwise.
Yeah, absolutely. That makes so much sense.
Yeah, so we need lots and lots of mental health providers. If anyone's interested, please.